Welcome, everyone, and thank you for your patience as we've worked out a few technical difficulties today. My name is Jason Lafser. I am the 2021 JAX Chamber Health Council President. So welcome to all of our members, all of our guests that are joining us today. If you don't know what the Health Council is, we are the council that's part of the JAX Chamber that is responsible for promoting health and wellness in the Jacksonville community. So thank you for joining us, and let's get started. We've got a full agenda today and a very important topic that we're going to talk about. So we're excited to hear from Dr. Hanel. Can I advance the slides, Amanda, or
Yes.
do you do that? So I've got a couple announcements we'll go over. I'll turn it over to Tina Robbins, who has a couple announcements and event updates from the chamber, and then we'll get right into our presentation. Depending on the time, obviously we're getting a little bit of a late start today. We may have some time for some virtual networking at the end. But if Dr. Hanel's presentation goes over, then we can certainly forego that. And then we'll wrap back up with some reminders about upcoming meetings as well. Go back a couple. You'll see on here, these are our 2021 Board of Directors. And I just want to give a thank you to all of these people. These are the ones that kind of make the meetings happen and make everything happen behind the scenes. And then two, just to let everyone that's part of the call today know, if you are interested in getting more involved with the Health Council, you can certainly reach out to myself or anyone that's on the screen. If you go to our website, you'll find contact information, email, phone numbers for any of these people, and we'd certainly be happy to talk to you and give you more information about the Health Council and different ways that you can get involved. There are several committees where you can help out. It doesn't have to be, a significant time contribution, but we certainly love to welcome everybody. And if you are interested in getting more involved, please do reach out. One big thing, this is very exciting since our last meeting. I think I mentioned when we met in January that we were revamping our sponsorship program and package for the 2021 year. And I'm very happy and humble to announce that we have secured 2 sponsors so far. So Florida Blue has continued to sponsor us again for the 2021 year as a platinum supporting sponsor. They've been a sponsor for us over the past several years, and so we're very happy to welcome them and have them continue to sponsor us. And then also Moran Builders has agreed to sponsor us as a gold sponsor for the 2021 year, and we are really looking forward to getting them more involved. And again, just a very thankful for both Florida Blue and Moran Builders for not only their financial contributions to the council, but also their time commitment. Each of these companies have members that are on our board of directors. And so we're really happy and thankful to have both of these companies as a sponsor for 2021. And I would just like to mention that if you are interested in being a sponsor, we have monthly sponsorships that are available. And so it's a great way to get your company's name and information out to our council and members and guests. So again, be happy to talk to anybody that is interested in being a sponsor of the Health Council, and a very warm thank you to both Florida Blue and Moran Builders. Quickly, I wanted to announce this upcoming event. Obviously today, Dr. Hanel is going to speak to us about health equity, and it's a very important topic, not only for the Health Council, but for the Jacksonville community. And really, not just Jacksonville, but the U.S. and the world. So in addition to what we're going to hear about today from Dr. Hanel, we are also jointly hosting another virtual meeting with the Downtown Council that's going to also be around the health equity topic. And you'll see we've got a great panel lined up. And so if you're interested, it is on a Thursday evening, February 25th from 5 to 6:30. It'll be a virtual meeting, and it is on the Chamber's website if you're interested in registering. or you can certainly reach out to Amanda at the email address below if you have any questions or would wish to register. We're really excited about joining and partnering with Downtown Council to put this on, and really looking forward to it. And with that, I'm going to turn it over to Tina Robbins for some chamber announcements. Tina?
Hi, thank you, Jason. Good afternoon, everyone, and thank you for attending today. Once again, if you would like to learn more about membership with our chamber or become more engaged with your current chamber membership and join the Health Council, we'd love to have you and be happy to assist you, or any of our board members would be happy to assist you as well. Our first event I'd like to talk about is on February 11th. It's the Beaches State of Our Cities Luncheon. This is an in-person event at the Casa Marina Hotel. It begins at noon. We're standing by CDC guidelines, I promise. And the speakers will be all three mayors from, we have Mayor Elaine Brown from Neptune Beach. We have Mayor Alan Glasser of Atlantic Beach, and also Mayor Christine Hoffman of JAX Beach, who will be speaking. This will be an exciting event. Once again, there's lots of great networking and lots of great information about our beaches. Please pre-register online. There's probably going to be a cutoff, and I think you would really enjoy it. So I'll be there, and I'd love to welcome you. On February 18th, we are also hosting a virtual coffee on the coast with Captain Jason Canfield. He is from the Naval Station Mayport. He's going to give us the latest information on our local military, so should be really, really interesting. There's no charge for this event. Once again, it's virtual. Begins at 8 a.m. and we should be finished by around 9. So please pre-register by February 17th if possible. And now I'd like to introduce our lovely board member, Ashley Skuskowski. I probably butchered her name, but thank you.
That's quite all right. Thank you, Tina. Thank you. So thank you all for joining us. We have a very special guest this month. Dr. Ricardo Hanel is coming to us, and he came to us, we're introduced through the American Heart Association. So I am going to turn it over to Ansley Lee to do the introduction of Dr. Hanel. And Dr. Hanel, thank you so much for being here.
Good morning, everyone.
Thank you guys for having me. Go, Ansley, please.
So I'm going to try not to butcher it, Dr. Hanel. So Dr. Hanel is the director of Baptist Neurological Institute, co-director of stroke and cerebrovascular surgery, and endowed chair of stroke and cerebrovascular surgery at Baptist Medical Center. He is an endovascular and microsurgical neurosurgeon specializing in groundbreaking, minimally invasive procedures to treat aneurysms. Dr. Hanel's expertise and dedication to Baptist has led them to achieve advanced certification for comprehensive stroke centers, awarded only to hospitals that demonstrate the ability to expertly diagnose and treat complex stroke and cerebral hemorrhaging around the clock, 24/7. Dr. Hanel completed his medical degree and earned part of his PhD in Brazil, as he was talking about earlier, before finishing his PhD in Buffalo, New York, and eventually making his way down to Jacksonville, where he also serves as board president for the First Coast American Heart Association. So without further ado, I will pass it over to you, Dr. Hanel.
Thank you, Ansley. Thank you guys for having me. I'm trying to share my screen, and Zoom is saying that host disabled.
I'm making you a co-host right now.
Awesome. Thank you.
Absolutely. Just one moment.
We had to switch
no
everything
problem.
up. So
all good.
yeah, this is not normally how it goes. So just so you know, we'd love to put you back for one that goes a little smoother.
You're now able to share your screen, Dr.
Awesome.
Hanel.
Awesome. Can you guys see that there now? Great. Can you see my screen? Awesome. All this good. When people are saying good things about me, I can see my father, my mom on the back of the room. In this case, on the other side of the camera, my mom would be crying because, oh, he's so good. My father would be laughing at, they don't know him at all. I'm just a Brazilian that try hard. And this topic is very dear to me. So coming from a different country, I think you come with a different perspective. And after what happened to George Floyd here, I became much more aware. We're so focused in our corner of the world, in my case, neurosurgery. And through my teenager boys, I become much more aware. Again, we all have to be part of the solution. We live in the best country in the world. I go all over the world, China, Japan, Germany, you name it, Brazil. This is the best country in the world. Again, it's up to us to make it even better. Again, we gotta decrease these differences that we have among us, and this cannot stop on just political talking. It has to be actions. So when American Heart put this together, I was working with Amber Ansley and the group before that. I think it's music to my ears. I think it's a great place to start. Education and healthcare, I think, is a great place to start. This is our team here at Baptist, and one of the things that I'm very proud, I was at a different institution here before where it was hard to get everybody through the door. When Hugh Green hired me to come to do this at Baptist, one of the conditions that I put to sign is we cannot discriminate. It has to be everybody. Anybody that knocks at the door has to be helped. And we are honored this now for 7 years. Awareness is the beginning of the cure. This applies to medicine, but this also applies to differences. You gotta be aware that there is a gap, that all of us have to work on this together. I'm gonna focus 5 minutes in a stroke and never lose an opportunity to educate. We're all potential patients, and American Heart is American Heart and Stroke Association. So whatever is bad for the heart is bad for the brain. Whatever is good for the brain is typically good for the heart. So these two organs are together. Stroke is just getting worse. Again, our population is getting older, is getting more obese with obesity, diabetes, high blood pressure, and cigarettes that dipped before because of vaping and others is getting worse again. This is a map of the West, 2000, 2006. And when I told you guys jokingly that we are South Georgia, you see that the darker the color here, the more number of strokes. So we call this the stroke belt, is right here, Southeast US. And this is my alma mater, Buffalo, sitting right there by the lake. So we call this the stroke belt. And we are right at the edge of stroke belt. If you go a bit more South Florida, you see that this is different, but we're there. But when you break this down, and this guy did a very good job breaking this down by zip code, you're going to see that there's a difference. Even inside the stroke belt, you're going to see that there are red dots and blue dots. And those are our zip codes. And we'll talk more about that later. We're proud that we can help from newborns to over 100-year-old people with a stroke. It is a huge burden for the society. And again, depending on the zip code, is more of a burden or less of a burden, but it's there everywhere. It happens to all of us. It costs the US about $65 billion a year. And it is #1 cause of disability in this country. And depending on the year, #2, #3, #4 cause of mortality. There's no quiz at the end, so you don't have to remember that. It is getting worse. What is a stroke? There are 2 types of stroke. I like to simplify things. Either you have a clogged pipe or you have a burst pipe, and we name ourselves plumbers of the brain. So if your pipe is clogged, we go with a roto-rooter and fish that clot out. If the pipe is burst, we can go through there, either stuff the pipe from the inside, if it's an aneurysm, or we can go through the skull to suck the clot out of there. Those are the types of stroke. I'm going to skip through that. When the pipe is clogged, the brain doesn't get enough flow. Depending where, that's the hard part with the stroke, depending where the stroke is, different than the heart, that is a pump made of muscle. Once you don't have blood flow, it hurts. And pain is a great awareness generator for humankind. When something hurts, you pay attention to that. The brain, the problem in general, when you have a clogged pipe, ischemic stroke, it doesn't hurt. And if this is on the right side, what we call the frontal lobe, you get weak on your left side. If it's on the back of the brain, we call the occipital lobe. You lose vision on both sides of the eyes. So it's much more complicated because of the higher function of the brain. There are things that you can do to prevent that. We cannot control if you're born boy or girl. For us, with XY chromosome, we're more prone for ischemic stroke. The ladies are more prone for brain aneurysms. So there are peculiarities into that. If you're African American, you're more prone for high blood pressure, more prone for a hemorrhagic stroke. If you're Asian, you're more prone for hardening of the blood vessels inside the brain. It does run in family, so familial history carries on. If you had a previous stroke and some other more rare conditions. But there are things that you can control. If you're diagnosed with high blood pressure, what do you have to do? You got to take your pill. You got to target a number under 140 or 130 for the big number, and other things. So high blood pressure, atrial fibrillation. Let's all do this exercise. Raise your right hand, get 2 fingers on your left. Right here, you can put your fingers there, and you gotta feel a little pound in there. That's your heart beating that you're feeling through the radial artery. If this heart beating, if you have an iWatch, they can do an EKG right there for you. No disclosures. I'm not sponsored by Apple. But if this pulse is off sync, if the beat is not rhythmic, you're off. So you gotta talk to your primary care physician, because atrial fibrillation is a very common problem. If your heart's racing, if your heart is off sync, you gotta talk to your primary care physician. And as everything else, Mick Jagger would tell you what a drag it is getting old. With us getting older, yes, everything gets worse. Atrial fibrillation becomes more common. So you need to be aware. Your mother needs to be aware. Your father, your grandparents. You gotta educate. Never lose that opportunity. High cholesterol, diabetes, that generates hardening of blood vessels. And cigarettes, that's a killer. If you don't want to have a stroke, if you don't want to have a heart attack, you got to throw this away. We all know that. Many of us around still do smoke. Alcohol, some good news here. A glass of wine seems to have some protective effect. So it's not all bad news. And you got to watch your lifestyle. You got to stay active. 30 minutes of walking a day is as good as a pill for diabetes. So you gotta watch your body weight. Very simple here, and Ansley can share with you guys. We have this out. Those are your own numbers. You gotta know your numbers, your blood pressure, your cholesterol, your blood sugar, and you gotta do this here. If you get a couple of yellows and red, you gotta talk to your primary care physician, and we'll be glad to share this with you guys. A little COVID information cannot go through a talk 2020 or 2021 without talking about this bug. It does seem that COVID increased the stroke severity and the disability and mortality. We work with a group from Thomas Jefferson, and Pascal Jabour has been all over as our lead investigator on CNN and so forth and so on, showing that COVID does make stroke worse. And sometimes it's the first presentation of COVID-19 infection. Those are the numbers from TJU and Mount Sinai that we work together. How to recognize a stroke? You got to remember, very simple acronym FAST. F stands for face. So if you're in front of somebody, ask this person to smile, and the smile is crooked, one of the lips doesn't move, that is what this F is there to remind you. Arms, put your hands up there. If you close your eyes, they should not move. The body has control for that. If one of the arms is weaker or one of the legs is weaker, that's a sign. If this person cannot talk clearly, and Brazilian accent does not count as a stroke. If this person cannot talk clearly, tell me your name. This person's name is Ricardo. He answered banana. So this person seems to be confused. Confused is a very, very vague term. And sometimes it's because the left brain of this right-handed person is not working. So if the person sounds confused out of a sudden, another key word, sudden, you're talking to, this happened to one of our Chief Shank. He was giving a talk to other 20 paramedics in front of his group. He put his hand on his face, and then when he tries to talk, he cannot talk. This guy is a highly educated paramedic. he could not talk, and all of a sudden he cannot move his right side. This paramedic looked at his chief and said, he's having a stroke. It can happen anywhere, guys. It can happen at any age. So if your friend, your mother, your grandma, anybody that you're witness, and yourself included, out of a sudden I cannot move my right arm. Out of a sudden I cannot see on my left eye. Out of a sudden I cannot talk. Dial 911. That is the right thing to do. All our paramedics are highly educated. We go around and educate, visit these stations all the time. These guys are trained to do that. Think about your mom is having a stroke. Oh no, I'm gonna drive her as quick as I can to the nearest comprehensive stroke center. And she has a seizure when you're driving your car. That's not a pretty scene. So that's not a good idea. We all try to avoid, oh, I don't wanna bother. Oh, maybe there's a cost on the 911 call. Just dial 911. They'll take good care of you. They're awesome. What do we do? If the pipe is clogged, we go fish this out as quick as possible. And sometimes it takes only 7 minutes from poking the groin. And that's what we do. I'm going to skip through time here. Sometimes you use medication. Sometimes you use roto-rooter. And that's typically what we do. Go through the groin. And that's a real picture. Through the groin, travel under x-ray, all the way to the brain. Go fish the clot out. And this person had a clot sitting right there. I go with this little scraper that we call a stent retriever. And this is the clot that came from her heart. And we save her brain. It's just a little cartoon, and we'll stop. Let's and switch the gears here while we're here all together. So this is what we do. The clot is sitting right there. We go through the groin with a little wire, and my wire I can steer, go left, go right, and you're gonna see that happening right there. I need to go on this guy right here in the middle. Here we go. So I'm moving this from the outside, and this little catheter is moving there. And now I can push my wire through that, and I'm gonna go all the way to the brain. So go with that wire. This is behind this person's left eye. In this case here, the cartoon. And I'm gonna go there and suck the clot out. So now I have a tube that goes from the outside all the way inside, and I have literally have a vacuum pump. The same company that does a breast pumping instruments does this pump for us. One of them. There are many models. So we go there, turn on the pump, and now we're just literally sucking the clot out, ingesting the clot, and now the blood flow is reestablished. This person's brain comes back to life. 1 out of every 3 persons, not many things in medicine have the same impact. 1 out of every 3 people that we treat today go home without disability, and that's pretty amazing. This has been available since 2015 only, so it's a very new thing. Everybody should be aware. This is one of our patients, came from Baptist South to downtown. The clot was right there. This is the roto-rooter. We sucked that little clot out of there, and now the vessel is open. This person walk home. The stroke is preventable. Stroke is treatable. The faster you get treatment, the better. And this needs to be available for all. And that's where you go to the next chapter. That's why we're here together to talk about disparities. We were part of Florida, Puerto Rico with Dr. Jose Romano and Ralph Sacco, that is a former president of the American Heart Association. We're part of this study called Disparities in Stroke that was supported by the NIH, that is our National Institute of Health funding, and by American Heart. And we measure over years what happened for stroke care in the whole Florida state and Puerto Rico. And there's no question what we're going to see here in the next couple of slides put together by the American Heart. It happens around us every single day. Mission value, mission statement proposed by the American Heart is to be a relentless force for a world of longer, healthier lives for everybody. American Heart is proposing to be, and is working, they have been working with this before, and we're proud of that, to be a catalyst on achieving this maximum impact, improving, extending people's lives, speaking with a trustworthy voice, inspiring the commitment, bringing science to life, and making a phenomenal impact on the lives of everybody around us. Again, this is an exercise that you can do with Michelle. She's 53. She's a Black female that works hourly. And you see by her zip code where she lives, and you see that her life expectancy is 6.7. If you Google right now, US life expectancy, if you're a lady, you're going to live longer. 83, 86, depending on the year that you're getting the reference on Google. If you're a boy, again, we last less. Again, all the ladies will be smiling, say, we know that. We die younger for many reasons, but it's very sad to say that because Michelle was born and live on the zip code 76104, because of many barriers to good food, barriers for physical activity. Very impressive for me when I moved from Brazil here, Jacksonville. It's amazing that we don't have bike paths going everywhere. Again, it's a perfect city to bike. We don't have. Again, we're working on that. I know it's a process. So all these things, her a low-wage job, limiting options in her area, difficult to get to follow the instructions because she might not have a good health insurance. So there are many factors that are all around her that unfortunately don't let her, she cannot get to her full potential of her life that should be 80 plus years old. So she will live shorter because of all this around her. I think American Heart, and I'm super proud of the team for choosing that. They want to be champions of health equity. Again, education and healthcare, I think that's a great beginning to tackle these gaps and this disparity. American Heart, through the decades, have been changing focus, first with education in the 70s, heart attack, educate everybody. What is a heart attack? How to be taken care of. In the 2010, risk factor management, 2015 with this social determinants of the disease and a transition from 15 to now, this is structural races. And we can discuss that. Had a very smart colleague on the board saying, Ricardo, I think we should not use the word racism. I think we need to acknowledge the differences and go after and work. Everybody work to decrease those differences. You see here on this, and unfortunately the slide is a bit crooked here at the bottom, but you see here, if you are a Black adult, you're 32% more likely to die from a heart attack. And if you're a Black adult, you're 45% more likely to die from a stroke. There are genetics that we cannot change, and that is true in some diseases for African American. It's true for some diseases for white. Is true for some diseases in Hispanics, for Asians. Every single one of our populations have differences, and those we cannot change. But when this is determined from access to healthcare and all those disparities that we map with the Miami group and American Heart is the showing here for us, I think we have to work on that. This is a spark for discussion, guys. I think the JAX chamber is a great group to jump on this, and we can do things together. I think that we got to just focus on ideas. I know Ansley and the group with Chelsea and others have been working very diligent on this, and even before this became a mission for the American Heart. I think we're on this together. I think this is a forum for discussion, for conversation. I wish I had all the answers. I don't. I think this is just a beginning of a discussion. I think we have to work on this together to make this a better place. I'm going to say again, coming from outside, this is the best country in the world, but we got to make it better because it has to be for everybody. I'll stop. Questions, comments, anybody? Throw a tomato through the Zoom. Let's see if you can do that.
That was great, Dr. Hanel. I don't know if we've got any questions in the chat room, but if you guys have questions, please. That was a great presentation, and you really did a good job of kind of dispelling it. Good news is it's videoed, so it's recorded. So we'll be able to go back and look at some of those slides. So it does look like we have a very helpful plumbing analogy for us. I concur.
Dr. Hanel, this is Ansley. I have a quick question for you. It occurred to me while you're doing this presentation. How long does it take for you to go through the groin and up to the brain to remove a clot like that?
It's a great question. I still consider myself young, Ansley. So when I started this in Buffalo in 2001, we would be there 3-4 hours to working. Now is not uncommon. On average, I just present most recent data with the most recent gadget that we have for a California company. That on average about 30 minutes, but there are cases that this is as quick as 5 minutes. So, and that's why the process is so important, that everybody's aware that this exists, that can be done and can help people, because sometimes it hurts. Have somebody in Valdosta sitting, waiting for a helicopter. Oh, now the weather closed. So it's going to take another 2 hours for the person to get here to be helped. And you know that the surgery itself can be as quick as 10 minutes, on average 30 minutes. And the brain, unfortunately, the quicker we get the clot out, the higher the odds of this person improve. We don't close the door. We used to say, oh, you have 6 hours. Now I have 8 hours. Now I have 24 hours. We look at the brain picture, and if the brain is viable, we go open the vessel, because if the brain is viable, and we can do that with technology, CAT scans, MRIs, if the brain is viable, time is not of a concern. We can go and open, but the faster, the better. So the closer you live to a place that can do this, like we do in Mayo, I think that's an advantage. But it has to be for everybody.
And that last comment about living close access to care, has everything to do again with health equity. Yeah.
It's and again, that's, I think, a revolution happening again. Everything in life has two sides. COVID was a disaster for many reasons. We all lost dear friends and family with this. My heart is heavy. We lost a 32-year-old guy from Brazil that was coming to be a fellow with us. He died the month before he came here. So we all have this near us. But I think this technology, again, we see way more patients today through teleconsult than we used to. Again, we have all kinds of cool Instagram ways to connect. Why you cannot have it, again, 40 nurses, 50 nurses, 50 healthcare professionals trained. Am I having a stroke? Boom, here's your free app, sponsored by all the companies, Medtronics, Strikers, and others that makes millions of dollars selling tools to treat stroke. I'm sure there's a way that we can make something that is very smart, like us here. We're looking at face to face. If we zoom a little bit, you can look at each one of us eye to eye. It's a great way to interact. I'm sure we're going to see an explosion of these tools that is delivering healthcare through technology, and technology is a big equalizer. I can connect with my colleague in China through COVID on the same week, and I gave a talk in Turkey, in South Korea, and in China within 24 hours. And the interaction naturally is not face to face. We cannot hug, we cannot be there, those side conversations that you miss from meetings, but you can deliver a lot. You can deliver a lot on this platform. And I think we should play smart, and the cost goes like this. So I think we're going to see that, but it's on us. If American Heart say we have this program, imagine the impact of that. Very different. Ricardo Hanel, little Brazilian, nobody's going to pay attention, but if we can together, JAX Chamber and American Heart, First Coast chapter, let's come with this idea. It can be a tremendous impact.
I think that's a good point, Dr. Hanel. This is Jason Lasser, and I think one question I would ask, so many times people get in the mindset of, oh, I'm just one person, I can't have a big impact. And maybe specifically around health equity, are there any recommendations that you have for what each of us could do to help? I mean, I think obviously just having the conversation and bringing awareness to the topic is a great place to start, because people may not even realize that what zip code you're born into has that big of an impact on your health. And so, besides, starting the conversation and bringing the topic up, are there any other things that we could be doing to help make this a smaller issue or less disparity amongst people?
I think we have to break down the problem. I think Ansley can tell you better about, for example, this pockets of areas that we don't have access for healthy food. Chelsea and American Heart Team, they have all kinds of ideas. So access to education. They ran, and Ansley can correct me if I'm wrong. They ran an education for girls only. Go Red for Women program from American Heart. Did this for young ladies. They called the STEM program at UNF. I think they had 200 girls being educated about all kinds of aspects of life. Again, we have a whole group of very educated people here, and we are example for these kids, and we can go and share our experience with them. There's so many programs out there. I think it's a matter of saying, okay, this is going to be we're going to focus on this little pocket. Again, I'll throw this out there for you. Again, we are working with some teenagers, trying to educate teenagers. I want to get all teenagers in all zip codes educated. Again, these kids, they're very smart. They're engaging. They love their little gadgets more than we do. For those of you like me over 40, but they again, they are connected. It's part of their DNA. But again, there are ways that they can go out there and educate. And if you bring this education home, so all kinds of ideas, Jason. It's a long answer, but again, it's just a matter of saying, okay, we're going to do something. Let's focus. We're going to partner with American Heart. Ansley and the team can come. There's again 4, 5, 10 initiatives inside American Heart working on this topic specific, and we can say, okay, for JAX chamber, it makes more sense to focus on this one or two, or for Jason makes more sense to go on this one. For Tina makes more sense the other one. So each one of us has a little bit different things that you feel comfortable and spark interest.
Yeah, thank you. Anybody else? Questions?
Well, I just again wanted to thank you so much for taking time to spend the last 45 minutes with us and go through that awesome presentation. I will just piggyback on that and say, we are partnering with the Downtown Chamber on February 25th. Dr. Hanel, we would love for you to be part of that. We've got 4 panelist speakers that will be part of that presentation. And it is exactly what you're talking about. It is health equity and the lack thereof, and or what we can do about it. So we'd love to invite you to be our guest. And I know that Amanda's got the information. If you want to let her know, again, please join us. So,
I can't answer on the top. Again, I'm honored with the invitation. I'll do my best to be there. Just going to check lovely calendars that we all we're all attached to. But I would love to join you, Ashley. And I'll tell you, if I cannot, again, I have 2, 3, 4 other colleagues here that are as passionate as I am about the topic, and somebody can be there and be part of the discussion, because talking about is the beginning. Again, awareness is the beginning of cure. We gotta map the problem and go after that, and stop pretending it doesn't exist.
Yeah, absolutely. Well, thank you. If we don't have further questions, then Jason, I'm going to let you take back over.
Yeah. Going once, going twice. If you've got a question, answer it now. If not, we do have about 10 minutes or so where we can do some breakout networking. And I don't see anything coming through the chat feature. I'll be quiet for a minute in case anyone wants to speak up. But if not, then again, thank you, Dr. Hanel. You're more than welcome to stick around for the networking if you want to. I understand everybody's calendar is busy, and I'm sure yours is no exception. So if you need to drop off, that's certainly understandable. Thank you again. Thank you, Ansley, for all of your help as well. And with that, Amanda, all right, are we all back together? Well, thank you, guys. We are almost at the top of the hour. Thank everybody for joining us today. As Amanda mentioned, the presentation was recorded, so we'll put that up on our website and share that via our social media channels. Keep in mind that our next monthly meeting will be the first Thursday of March, and the date escapes me right now. I want to say Do you have that in front of you, Amanda? 4th, maybe? So
Yes,
March
March 4th.
4th, we'll be back together. And also, like I said, and we mentioned a couple times, February 25th is the joint meeting with the Downtown Council on the Health Equity Panel. So please join us for that. And with that, I'll just say thank you, everybody, and we'll look forward to talking soon.
Thanks. Bye, everybody.
Have a great day. Thank you for joining us.
Yep.